In the late 1970s and early 80s, 14 young men shared this summer house on Fire Island, east of New York City. At least 2 of them had been known to have sex with Gaëtan Dugas. 10 of the 14 men have now died of AIDS. Of the surviving 4, 1 has the virus but no symptoms so far. The other 3 say they haven't been tested. Maybe they don't want to know. When those vacation buddies started dying, no one knew what they were dying of. And outside the gay community, no one seemed to care.
There was a massive disinterest in doing anything for these awful guys that lived this awful kind of life.
In a strange professional way, was it good news when you began to find out that hemophiliacs were getting this disease, that drug addicts might get it, that it was not an exclusive gay plague?
It was terrible, useful news, not good news.
By the end of 1982, the public health doctors knew that AIDS was like syphilis before there was a cure, a 100% fatal venereal disease. At first, the gay community resisted the obvious prescription, changing its sexual practices.
They were screaming civil rights. They were right. We didn't want them to lose their civil rights. But when it clashed with the public health, when it clashed with life and death, then you simply had to do something about it. I told them, what good are your civil rights if you're dead?
Eventually, common sense and the mounting death toll prevailed. The bar scene calmed down and the bathhouses closed. But, says Shilts, while safe sex became dogma in the gay community, on a national level in Washington, politics got in the way of protecting the public health.
AIDS did not just happen. AIDS was allowed to happen. This disease did not emerge full grown on the biological landscape. And I don't think you can look to medicine in order to understand how AIDS was able to spread so quickly across this country unimpeded. I think you have to look at the politics of AIDS. And when you get into the politics of AIDS, you look at one very unfortunate timing factor of this epidemic. AIDS was detected 5 months in to the first Reagan administration. And this administration had come in with one, overriding commitment. And that commitment was to keep the lid on federal domestic spending. And consequently, during the first years of the epidemic, whenever there was a choice between do we go whole hog against this epidemic or do we keep the lid on domestic spending, the Reagan administration invariably chose to keep the lid on health spending. The fact is that the files of the Reagan administration are redolent with the odor of smoking guns.
April 12, 1983, the Secretary of Health and Human Services told Congress that AIDS was a #1 priority, and they had all the money they needed. On that same day, this man, Dr. Donald Francis, the man in charge of AIDS laboratory research at the Centers for Disease Control and a world-renowned expert on epidemics, wrote this memo to his superiors. The inadequate funding to date has seriously restricted our work and has presumably deepened the invasion of this disease into the American population. Dr. Francis pleads, in this vast and wealthy country, there must be a way to get $10 to $20 million immediately for this disease. I stress speed because the usual government funding and spending processes are so slow as to be unacceptable in such an emergency situation. We tried to interview Dr. Francis, but he declined, citing the recommendation of his bosses in the government.
The whole problem is that people are dealing with AIDS as a political problem instead of a public health problem. And in 1983, the politics were, let's hold the line on domestic spending. And so politics was allowed to triumph over public health. In 1987, the political question is, should we let a certain political version of morality triumph over what is good public health and educating people? And again, politics is triumphing over public health.
Did the administration play politics with the public health? Well, whether they did or not, they certainly don't want to talk about their record to us now. First, we went to the Department of Health and Human Services. An official there agreed to an interview, but we were told his authorization was withdrawn. Then we went to the Office of Management and Budget, the arm of the administration that approves requests for AIDS money. They sent us to the White House. Here, a high official agreed to an interview, but at the last minute, his authorization was withdrawn. In the end, no one in the Reagan administration would talk about the politics of AIDS, past or present.
People forget that All these delays in getting funding, these delays in getting decent education and prevention programs for AIDS, you don't measure those delays in weeks or months or years. You measure those delays in lost lives.
Gaëtan Dugas, patient 0, died of AIDS on March 30th, 1984. As of October 1987, 24,947 Americans have died of AIDS, and experts estimate more than another 150,000 will die by 1991.